and welcome to Bariatric, the podcast. I'm Dr. Connie Stapleton, your host. And if you recall, in the last episode, we reviewed the first 5 or 6 chapters of my book called Mind Prep, the Book. And this book is the creation following a series of 10 videos that I have used for, oh my gosh, probably 15 years. Every time I talk to a patient in a pre-surgical psychological evaluation, I required that they watch the Mind Prep videos. Well, I had the scripts for these videos, and I thought, why have I not turned this into a book? So I added a whole bunch more information that I've learned in the last 15 years after creating the videos in the first place, and I created Mind Prep, the book. So in this episode, I am going to continue the summary of the final chapters of Mind Prep, the book. So I highly encourage you to go back and listen to the prior episode where we talk about the first several chapters. So we're going to start right in here where we left off. And I left off at the chapter I call the Gotta Do-ums. Now, if you've followed any of my work over the last 20 years, you know that I am big on what I refer to as the Gotta Do-ums. And the Gotta Do-ums are a list of behaviors that I gleaned from a lot of research, a lot of books, a lot of very prominent professors and people who work in the in the weight loss field. And the gotta do's are the behaviors that over time, via research, show this is what you do if you want to keep your weight off after you've lost weight, whether that's from a fad diet, whether that's from a medically supervised diet, and it holds true if you've had weight loss surgery as well. So the gotta do's are just that. Like it or not, you gotta do some of these things on a consistent basis for the rest of your life. Yes, for the rest of your life, but only one day at a time. So you really only gotta do them today. But here are what the gotta do's are. So you got to make consistently healthy food choices. Nobody's going to keep their weight off except those very few percent of people who literally can eat whatever they want and not gain a pound. That is not very many of them, BT dub. So if you think everybody else can eat anything they want, keep their weight up, it's not true. Most people who maintain a healthy weight work at it. So the gotta do's are the things that most people with a healthy weight actually do. So if you want to keep your weight off after weight loss surgery, these are the things you got to do. So make consistently healthy food choices. That doesn't mean perfect. That means consistently you eat very healthy. And as a bariatric patient, the way of doing that has been pretty much spelled out for you. Every time you eat at whatever increments your dietitian has told you to eat, you start with protein. So you eat protein, vegetables, fruits, and then you eat a couple starches a day, and once in a while, you have some kind of treat that you're not going to have on a daily basis because it's going to put weight back on you. Consistently healthy foods. Maintain portion control. So you can eat way too much of a healthy food and gain weight. So the dietitian at your bariatric practice is going to teach you about portion size. You need to follow through with that for the rest of your life. You've got to exercise on a regular basis. Please, Connie, don't tell me I've got to exercise. Change the name. You got to move your body for a consistent amount of time that makes you maybe breathe a little heavier or sweat a little bit, but you got to move your body. You've got to exercise if you think you're going to keep this weight off on a regular basis. Does that mean every day without fail? No. I say more days of the week than not. And if you want to do more days than more days, do those. But you've got to exercise. Drink plenty of water throughout the day and take your bariatric specific vitamins. Those two go hand in hand. So take those bariatric specific vitamins. It's like people who have a baby take prenatal vitamins. You're a bariatric patient. Take bariatric vitamins and drink that water throughout the day. Eat breakfast. Eat all the meals throughout the day. Eat at every increment that your dietitian has told you you need to eat at. Start with protein, right? Plan your meals, follow your plan. And that is a do it as it works for you kind of thing. If you want to have every single thing planned out for the day, then do it. If you want to have, I have these protein on hand all the time. I make sure I have a protein drink or a protein bar with me at all times, just in case I'm stuck somewhere and I don't have anything to eat. But plan your meals and follow your plan to whatever degree works for you. But you've got to have a plan so that you follow the bariatric guidelines with your food. And it's a great help to maintain a diary or a log of your food intake and your exercise, because this can really help you pinpoint problems. If you're looking at your food diaries or your app or whatever it happens to be, and you see an increase in your weight, then you can say, what am I doing differently? And you can look over time and see, oh gosh, I've been skipping this meal every day. That's not helping me. Or you can look at your exercise journal and say, golly, I haven't been exercising nearly as much as I thought I had. So you can fix mistakes that way and find corrections. Get enough sleep. There's so much research that is showing the importance of getting enough sleep with maintaining a healthy weight. You can read about that if you choose to. Remember, immerse yourself in the information it takes to set yourself up to be successful, not just immediately post up, but for the rest of your life. Utilize a healthy support system. This is important, and you need to learn the difference between a healthy support system and those people who say they're going to be a support system, but are kind of, stabbing you in the back along the way, some passive aggressive behaviors. You need a healthy support system. And often that means the people who are going to love you and celebrate with you, but also express concern when you're not following through with what you said that you wanted to do. So have a healthy support system, engage in your online support groups, go to your support group meetings if you have them, find a mentor. We talked about mentors earlier in the book and in the podcast in the prior episode. A mentor that's many, many years past surgery and is doing very, very well. And this isn't necessarily a gotta do them, but it's a highly suggested do them, which is get some individual therapy or join a group therapy so that you can learn the skills that you need to deal with stress and not turn to food. If you have a food addiction, weight loss surgery doesn't treat food addiction. Gee, I wrote a book called that as well. You might want to look on it if you have a food addiction. And participate in online classes or participate in webinars by dietitians or um, therapists or your weight loss surgery or the weight loss office or whatever you need to learn. If you need to learn healthy communication skills, if you need to learn how to set boundaries, then I encourage you to do that. So those are the gotta do ums. Like it, don't like it, really it's irrelevant because you gotta do them no matter what. All right, the next chapter is adjusting to your new life. Again, if you haven't had surgery yet, you can read this book all the way through because it'll give you some heads up on what's coming after you've had surgery. If you had surgery 10 years ago, read this anyway and you'll go, "Oh yeah, I remember that." Or "Yeah, I remember that." And I'm still not engaging in what I might be doing to make that easier for me. So, adjusting to your new life after the surgery is filled with a lot of different experiences for people. Some people have the surgery and they're like elated. They're like, oh my gosh, this is the beginning of the new life I've waited for my whole life, right? And it's like, whoa, I can't hardly wait to start. Other people have different emotional reactions to having surgery, some of which might be related to having had the surgery itself, right? Some people are like, oh my God, I'm so depressed, which could be a function of having had the surgery and your body being depleted of nutrition and sleep and being on pain medications or whatever. So if that's the case, don't be too alarmed, but let somebody know. Some people have buyer's remorse. Oh my gosh, what have I done? What have I done? How could I have done this to myself? And I've worked with not very many, but a handful of people who were absolutely in hysterics over the fact that they couldn't undo the surgery. Over time, usually a short period of time, they calm down. And almost everybody I know who's had weight loss surgery says I would do it again in a heartbeat. So don't be too concerned if you're not like, oh my gosh, I can't wait. This is the best thing. What you need to do is give yourself permission to accept however you're feeling and to talk about it. If you're feeling really anxious or really depressed, let somebody on your bariatric team know, or let a close family friend know, or somebody in your family. But make sure you let somebody know, especially if you're dealing with extreme anxiety or buyer's remorse, or if you're feeling any depression. So the range of emotions immediately after surgery varies a lot because your body's got to heal, the weight loss begins, and for many, many months or weeks or however long it takes, you may feel weak, maybe not up to yourself. You're going to feel like yourself in months, but um, you're going to be honeymooning, right? And who doesn't want a honeymoon? Like, could we just live our life on a honeymoon? But that is not how life works. And some people start in on that honeymoon feeling right away, like, oh, this is so great. This is the best thing that ever happened to me. And for some people, it does take weeks and months to get in that groove because they have a lot of fear about, oh gosh, how are people going to react to me? And I didn't tell certain people. And what am I going to say when they start asking me what's happening? And how do I deal with the people at work? And there's a lot of different things that may surface for you as the weight starts to come off. So there's the physical recuperation, there's your body's recuperating from having had a surgery, there's that whole hair falling out kind of thing that happens for a lot of people directly related to having had the surgery. There's so many feelings that may be fighting for your attention at this time. You've got excitement, right? I've waited for this forever. The weight's finally coming off. Maybe you have fatigue that's just like, oh my gosh, I didn't think I'd have to be sleeping this much. Maybe you have so much hope and joy mixed with fear. So all of this may be happening at once, and you're like, what the heck is going on? We compared weight loss surgery and the whole honeymoon phase to people who are preparing for a wedding and go through the honeymoon phase, right? They say, weddings take a lot out of a people. Surgeries also take a lot out of people. And there's so many expectations. A lot of people think life is going to be perfect after they get married or perfect after they have weight loss surgery. And for a lot of people, they are so disappointed when they find that not to be the case. But pretty much in those early weeks and early months, people are tend to be more on the elated side because that stubborn weight is falling off. And for the first time in a long time, maybe for forever, you have more energy. You, for the first time, may like seeing yourself in pictures. You may, for the first time, love some attention that you didn't like before. Some people don't like that. Some people don't like the attention at all after surgery, which can lead to regain. Another story for another chapter. But in those first weeks and months after surgery, the physical changes are absolutely astonishing. Some are joyful and some lead to tears. So many people are so excited to go into a store they've always wanted to purchase clothes at. They try those fun clothes and all of a sudden they're sobbing in the dressing room. Partly because they're like so happy, and partly they're so sad because they were unable to do that for so long. So, you know, try not to should on yourself during this period of time, right? Don't think you should feel this way or you shouldn't feel that way. Allow yourself to feel however you're feeling and talk about it with somebody. Talk about what's going on with you, even if you don't have the feeling words. So many people are able to enjoy this period of time and they start exercising, which they've never done before, and they start being social, which has been very difficult for them before. They're relieved of the, oh my gosh, what if I can't fit in a chair at the restaurant? What if related to weight? Because it's no longer a factor. And they start to experience so many non-scale victories, the NSVs, tying your shoes and taking care of your personal hygiene and, the seatbelts fitting and all those things that were such an emotional drain in the past. So, enjoy the selfies, enjoy being complimented, enjoy the things that come along with that rapid weight loss. But before you know it, and most of the time before you're ready for it, the excitement and newness kind of fades away, right? And you settle in. People no longer make a fuss. You're just a person who is now a healthier weight. And it's not every day, oh my God, what have you done? What are you doing? Oh my God, you look so great. which for some people is a lot of fun. For most people, I would say there's a lot of enjoyment in that. There's a handful of people who are like, don't look at me, don't talk to me. I don't want to be the center of attention. And I get that. For them, that newlywed phase is very, very difficult. But you're going to come to the end of the honeymoon stage and life is going to settle in. You're not losing weight as fast as you were, which freaks people out sometimes. You're not being made a fuss over all the time, which some people struggle with. An idea here is start rejoicing over the things you're able to do and start enjoy living the life you had hoped to live. But what happens a lot of times is that people get really upset because they find out that losing weight didn't make them happy all the time. Losing weight didn't help them long term with their self-esteem. There's a period of time people go through immediately after the surgery as they're losing that weight and it's just fallen off, where self-esteem seems to rise very rapidly. I feel more confident. I feel like I'm making decisions. I feel like I'm setting some boundaries, and that is great and that is wonderful. And sometimes it's genuine, but not if you had struggles with your self-esteem going into surgery. Surgery is not going to fix that. After the honeymoon's over and life comes back to normal, the things that plagued you before surgery are going to start eating at you again. And I know people don't want to hear that, but I find it to be very, very true. And how would I know this? Because I do a lot of post-op therapy. I do post-op group therapy. I hold retreats for people who are at different stages in their post-op and pre-op life. And for a lot of people, it's such a disillusionment when they find out surgery didn't solve my problems. I'm not happy even though I weigh such and such. I'm not happy even though I fit into this size clothing and I thought I would be. And it's really, really hard if that happens to you. Now, that doesn't happen to everybody, but here's the deal. If it happens to you, what are you going to do? A lot of people, what they do is they resort to what they used to do. They go back to emotional eating, or they start using food as a comfort to increase their dopamine levels because the high of the weight loss has worn off. And so they find highs from engaging in food like they used to. And that leads to even more miserable cycles and to regain. So some people really resist settling into this more at ease, less complicated, less chaotic way of life. It's like, oh, just settle. The joy for me to watch people would be for them to lose weight, not get hung up on a scale, not get worried about a goal weight, but to say, I've lost so much weight. I'm doing what I said I wanted to do before surgery. I have a healthier life. I have a more active life. I'm engaging in the things that I wanted to do, and life is good. But so many people then say, but I'm not at the weight I want to be. I'm not at the goal weight. And they start traumatizing themselves over this goal weight, or they start traumatizing themselves and creating chaos in their lives because guess what? They're used to chaos. Some people are actually hooked on that emotional roller coaster of yo-yo dieting. Now, who would admit that? Not very many people until maybe sometime down the road when they get into therapy. I have so many people who end up saying, you know what, I'm really addicted, not in a literal sense, but I'm hung up on that chaos. My life has always been chaotic, and this is a way for me to keep it in chaos. Now, why would somebody want to keep their life in chaos? Because they don't know what to do with calm life. That may not sound sane or rational or logical, but it's the truth. If a person comes from a childhood of chaos, that's what they know. And so they're going to create chaos in their life in a way that a lot of people do this is to focus on their weight and the scale and going up and down because it's a way to engage in chaos, which is what is familiar and known to them. A peaceful, easy life is boring or unnerving or produces anxiety until you learn how to live in peace. That often requires some therapy. So, becoming settled in is wonderful for some people. And for those of you who enjoy that, I am so, so happy. It's about getting on with your life, living at a healthier weight, and being grateful for the fact that you were able to get this stubborn weight off through surgery. And then you go about learning the skills and engaging in the lifestyles that gotta do them. Other people, it's getting to that place where weight stabilizes is really, really an unsettling place. And some people become really, really lackadaisical and they start engaging in those old habits before that they engaged in before. They're like, oh, this won't hurt me. I can eat this and I didn't gain any weight. Well, let me try this and this and this. And they quit eating according to their dietitian's recommendations. And they quit eating protein first and they quit taking their bariatric specific diets. Sometimes when people lose weight, friction comes up within their families. Their kids feel like they're all busy doing things without them, and the kids feel left out, or the spouse feels insecure. And, that causes some issues in the relationship. Ooh, so post op life can sometimes bring about issues that were not at all anticipated. Some people, who were really grateful during the honeymoon to see that weight coming off and weren't so worried about the loose skin now start, you know, focusing so much on that. They loathe their skin and their body image is worse than it was before they had surgery. So there's a lot of emotional ups and downs, even though a lot of people aren't prepared for that. So when that happens, if you have a mentor who's 5 or 6 or 12 or 20 years out from surgery who's doing really well, they are a great person to go to. If you have a support group where there are new patients who've been out several years, it's a great place to go to. If you have a therapist, it's a great person to run things past with. So life is supposed to settle into a routine, but that freaks a lot of people out. For so long, people were like, I wish I could just stay at a relatively same weight so I could wear the same clothes. But when that happens, they're like miserable. It's like, well, what's up with that? Right? Not happy either way. That's a sign that there's something going on the inside. So a lot of times people become complacent, effort fades, those carbs that were so easy to resist after surgery start calling your name again in the grocery store. The hunger that was gone for so long, all of a sudden it's like nagging at you and you're aware of it again. If you had low self-esteem and it seemed like it was gone for a while, it seems to have crept back in and you're like, wow, I'm really discouraged because I thought my life would be great. And this, for some people, if they haven't settled into being settled in, it leads to troubled times. So, people become complacent or start regaining, or they start having issues in their relationships and they don't know what to do, or their self esteem is plummeting. So when you land in troubled times, if that is you, then you've got some options. You can continue on the same path that got you into troubled times, meaning, don't deal with the issues, don't get help, don't talk to post-ups, don't talk to your professionals, and things probably will get worse. Or you can return to the old days and the old ways. You can ignore the problems by using food to, solve all your problems. Well, that's only going to eventually lead to regain also. Or you can get help and get happier. What I mean by that is go to your bariatric professionals, get into some therapy, get a bariatric coach, do what you need to do. And I personally vote for door number 3, get help and get happier. Because here's the deal. People who find themselves in difficult situations and take whatever they need, gather the grit, get the gumption, and work through these hard issues are absolutely the happiest people I have ever met. I recently had a patient tell me she's been involved in 12-step programs for years. She said she has the most respect for people in those rooms because they've been through so much adversity. They've gone through so many difficult things, and they have managed to find the tools to learn the skills to engage with people who are also working to have a better life. And they're the happiest, most grateful people she's ever met. And I tend to agree, having been in a recovery program for over 30 years. I think people have gone through adversity and looked for and learned the skills to overcome it are absolutely some of the happiest most grateful people I have ever met. The next chapter in Mind Prep, the book, is all about dealing with emotions. And this is a struggle for people, which they probably never in a million years would have had anticipated when they thought of having weight loss surgery. What happens for a lot of people is as the weight goes down, a lot of emotional issues pop up. When I poll people on Facebook groups and ask them what their biggest fears are, if they lose that regain, because they'll regain, they're like, I don't want to feel how I felt. I don't want to experience emotions. I don't want to feel pain. I don't want to deal with issues that have surfaced. So, learning to deal with emotions may be for you one of the absolutely most critical tools and skills you can do as a post op. Because if you don't, and these things are kind of pushing at you, it's kind of like imagine somebody holding a closet door shut and they're putting so much energy and they have to do it all day, every day, or that closet's going to open up and spill out over them. And what might be spilling out over people are, unresolved issues like, oh my gosh, I'm being tormented by the comments my mother said to me about my weight growing up, or oh my gosh, all of a sudden I'm remembering everybody who made fun of me when I was in school. Oh my gosh, I'm having these memories of, this abuse or this neglect, or it never bothered me that my parent left. And now all of a sudden I'm thinking about it all the time. Don't know how to deal with the feelings? I return to emotional eating to shut them down. We don't want that because that leads to regain. So this chapter is talking about feelings 101. How to identify my feelings? What do I do with them when I learn to identify them? Not just cognitively, but where do I feel them in my body? How do I know if I'm anxious? How do I know if I'm angry? If your jaw tightens or if your fist tighten, or maybe if you're feeling anxiety, your breath shallows, or you get tingly feelings in your arms or your hands. So, learning to identify emotions in your body and to put a label on them can really help you learn not to turn to food to cover them up or to quiet them, because you can learn what your emotions are telling you. Oh, I'm realizing I'm lonely. Well, what can I do to deal with this loneliness rather than turn to food? Oh, I'm finding out that I'm really angry. I just had this encounter with my boss and I'm really ticked off and I really just want to go to the drive-through. Well, what would be a healthier way to deal with that anger? These are critical skills to learn to refrain from regain, to refrain from emotional eating. The number one people say they regain for is stress. In other words, I don't know how to emotionally handle life without food to help me. What you're doing, in essence, is expecting a surgery to take care of something that no surgery can do, to help you learn to deal with stress without turning to food. That's not a thing surgery can do. So you are left having to learn those skills if you want to refrain from regaining. So this chapter is super critical because it tells you how to learn to identify, name the feelings, how to figure out what you need from an emotional standpoint. Your feelings will tell you what you need, and then you can learn what would be a healthy way for me to get this need met and not turning to food. Absolutely critical chapter, as is the next one, because it's talking about weight loss and relationships. I'm afraid to tell you this, but I'm going to anyway. The divorce rate for post-op patients is higher than the national average, and it ranges about 70%. What up with that? Relationships change after weight loss surgery. Sometimes it's during that honeymoon period when people have that often fake increase in self-esteem. It feels like real increase in self-esteem, it may or may not be, right? But if you run off and divorce your husband in the first year after surgery, you're probably making a mistake. It doesn't mean that you may not have gotten to divorce eventually, but making emotionally driven decisions based on this newfound, I got this life kind of thing is disastrous for many people. So don't make any rash decisions in the year after weight loss surgery. And I would advise 2 or 3 years, because too much is changing with you interpersonally and in your relationships for you to even have time to figure out what's happening, much less know how to deal with it in healthy ways. So your emotions sometimes drive the bus right into a brick wall. I'm not happy anymore, and I wouldn't have married them if I thought I had other choices. And, I married them because they're the only person that I thought would marry me. That may all be well and true, but take your time to figure that out. Don't just react because all of a sudden you feel like, I got this. Look at me. I'm a hottie hot hot, because you may be a hottie hot hot and you may have those thoughts. But the truth is, I believe most of us hook up and marry partners that we're supposed to be with. We just have to figure out how to overcome the issues we don't know how to deal with in our relationships and with our self esteem and with the whole weight loss thing complicating it. So take your time, get to some therapy, and not only with your significant others, but with your children, because those relationships are going to change. You may all of a sudden be the social butterfly, and they were used to taking care of you, and now they don't feel like they have a place in your life. So those relationships will change. And your relationships with family members will change, and with friends, because some of them don't want you to get better and be happier and be more confident and have more self esteem, because misery loves miserable company, right? So if you were the fat friend and now you're the, oh my God, amazing, so amazing friend who's living the life I wish I could live, well, maybe I don't want to hang around with you anymore. Not a healthy thing, but relationships change. So this chapter deals with the relationship that changes with food, coming to a healthier relationship from an unhealthy relationship with food. It can help you learn to have a healthier relationship with yourself and deal with some of the demons that may creep up after the honeymoon is over. It can help you deal with changing relationships with your children, your family members, your coworkers, your friends, and your significant others. So you don't want to skim over this chapter. And did I mention that in each chapter, there are sections throughout called Check In with Yourself? And there are some questions in there and some spaces for you to answer them. And at the end of each chapter, there's also some additional exercises that you can think about doing. There's a whole chapter devoted to your relationship with yourself, because when I say your relationship with yourself is going to change, I mean your relationship with yourself is going to change. And it's usually 2, 3, 4, 5 years out after surgery that you kind of come to terms with all of this. And a lot of people need help making sense of it. And the retreats that I do are pretty much centered on, okay, you're this much beyond surgery, you're this much, what are you struggling with? And some of it has to do with food, but a lot of it has to do with, I'm not sure I'm doing what makes me happy. I'm not sure how to deal with my family members who continue to try to sabotage me. I'm not sure how to deal with these old feelings that won't go away. So this relationship with yourself, which, by the way, I am absolutely convinced is the driving force between what lends a person to being ultimately long term successful with weight loss or not. Yes, there are biological factors that will always have an influence in your life and your weight. I'm not saying anything about a goal weight, I'm talking about living a healthier life where your health is at as good a point as it can be. You're going to still have health problems, right? You've got genetics influencing all that. You may have health problems, at least. And there are life problems. There will always be life problems. So either you've learned to deal with stress, not using food, but learning healthy skills, or you're going back to learn using food to deal with life stress. Hopefully, you're making the decision to learn to deal with life stress in healthy ways. Because after all, like I said, that's the number one reason for weight regain. And surgery doesn't tell you how to deal with stress. You got to learn it. But your relationship with yourself is going to change throughout your life, but a lot in the few years after surgery. So learning how to deal with the changes, the unfamiliar thoughts, the unfamiliar feelings, the nagging things that nag at you that you just don't have the skills, get help to deal with those things. Help is available for you. And learning how to set boundaries not only with other people but with yourself. We expect other people to respect our boundaries, but sometimes we fail to set boundaries with ourselves. For example, you may feel, excuse me, to set boundaries with yourself where food is concerned. Setting boundaries like I don't eat food in my car, that'll maybe stop you from going to the drive-through. Setting boundaries, I don't have a secret stash drawer, that may prevent you from returning to old habits of munching during the workday. Staying away from, limiting your time on recipes and social media that's all about food. Staying away from the food stay away from it. Learning to accept, if this is true for you, that you're a food addict, and that may be different into huge relapse. So, learning who and what you are and your relationship with food about. Most importantly, you want to make peace with yourself because, as I said, I believe wholeheartedly that the relationship that we have with ourselves, which means a healthy self esteem, improving your self worth, because it has been shown by many, many professionals, by much research, that how you identify where your self worth is going to determine to a large degree how you engage in life. So, a person who's beating themselves up with shame and criticism and calling themselves names and don't believe they can do something, their behaviors are going to reflect just that. It is absolutely a self fulfilling prophecy. People who are willing to work on changing that negative self-talk, who are willing to learn the skills, who are learning to recognize that they have worth, to recognize that there are so many great qualities about them because there are people who love you. There are people who love all of us and they don't love us for our size or our weight, at least meaningful relationships, right? They love us because of who we are. But if you don't learn to love who you are, your behavior is ultimately going to reflect how you feel about yourself. And the bottom line, my friends, is like it or not, people who feel lousy about themselves, their behavior is going to be lousy toward themselves. People who feel good about themselves do not engage in behavior that is self harming. Let me repeat that. People who overall feel good about themselves are not going to engage in repetitive, self harming, self destructive behavior. It's not going to happen. So you can look at your behavior, and that's a key to letting you know where your self esteem really is. And I know some of this stuff is annoying and hard to hear. And I say that throughout the book. But the reality is, if you're not going to deal with reality, you're not going to be able to make changes. So read this book, come to terms with some great things about yourself because you may recognize, you know what, I got a lot going on for me. And I'm going to capitalize on that. And I'm going to keep those thoughts at the forefront of my mind. And I'm going to ask people what they like about me. And I'm going to choose to believe them. And then I am going to slowly but surely increase my self esteem, and my behavior is going to flow in line with that. And the last chapter in the book is about the importance of taking care of yourself for the weeks, months, and years after surgery, the aftercare. And that doesn't mean just the scale, it means learning the skills to stay away from emotional eating. It means learning how to deal with addiction if you have a food addict, because weight loss surgery does not treat food addiction. Weight loss surgery does not help you on long term increase your self esteem. Weight loss surgery does not help you learn, just by virtue of the surgery, how to avoid emotional eating. Weight loss surgery does not help you learn how to deal with life stress without turning to food. You've got to take charge. And if you engage and the aftercare options available to you through your program, that is a great thing. A lot of programs don't have a lot of long-term aftercare. They may market themselves as having that, but basically that means we'll take your labs, we'll have a checkup for you every 3, 6, 9 year and every year after that. That is not what I mean by aftercare. What I mean by aftercare is learning the skills so you don't emotionally eat. It's learning to come to terms with wherever your body chooses to land. That's good enough. Learning to come to terms with the gotta do's. If I want to maintain my weight list, then I gotta do this. And then engaging with people who will support you, lift you up, help you with your accountability, help you with your celebrations, help you rejoice in who you are aside from the size of your body while you learn to live life according to life's terms, meaning there will always be stress, there will always be health problems, there will always be family members who are aging, there will always be children who maybe are driving you crazy or in trouble at school or whatever. Life will happen, always and forever, guaranteed. How you deal with life can improve. How you deal with stress can improve. How you deal with changing relationships can improve. How your self esteem builds or plummets, you have a lot of control over, but you need to seek out the help. So immerse yourself in the podcasts, the books, the classes online, the reading available to you, the education that is made available to you through so many options. And please, if you need the help of a professional, seek it. Whether it's a bariatric, yes, a bariatric dietitian, somebody to help you with exercise, a bariatric coach or a bariatric therapist or any kind of therapist should be able to help you do things like increase your self-esteem or work through conflict in your family or help you learn to uh, learn healthy coping skills. It doesn't have to be a bariatric therapist, but if they have experience in bariatrics, all the better. Find out what you need and then get the help that you need. It is completely and 100% your responsibility. So the reality is, if you want to recover from the disease of obesity, which is a chronic disease, recovery means living life fully. So seek out whatever it is you need to be able to do that. Recovery from obesity is hugely a mindset. That's why this book is called Mind Prep. Recovery is about accepting some things that you can't change and accepting some things that you need to do. And a recovery is not about trying. Recovery is about doing. Recovery is accepting that you need to put forth effort and increase your accountability forever and ever and ever and ever and ever and ever and amen. And happy ever after, that is a fairy tale. But you can be happier ever after. You can be happier more often. And you can be happy without your source of happiness being food or finding some other unhealthy behavior for your happiness. Happiness comes from within, my friends. So read this book. It will give you a great head start to finding that happiness. And obviously, the Berry Aftercare program will absolutely help you with the Berry Aftercare because we have a cook, we have nutrition, we have a licensed marriage and family therapist, we have a coach, we have movement experts. We cover all of the bases. And you're not going to get all of the bases covered in any other Berry Aftercare program that I'm aware of. In fact, we're the only ones called Berry Aftercare. So it's a daily process where we're encouraging you all day, every day. So check out www.bariaftercare.com. Let us help. But most importantly, be a friend to yourself. Get the help you need and live your happiest ever after, whatever that can be. Thank you for joining me and spending time with me, and I will see you again soon. I hope you will encourage your friends to listen to Barry Aftercare, the podcast. I appreciate you, your time, and your loyalty to improving yourself. Thanks again, my friends. See you next time. It's your health, your responsibility this day and every day. Bye-bye.